Hello, my name is Marco Alvarez-Patino. I'm a Wayne State University civil engineering student. Ketamine is a drug used for anesthetic purposes and has recently gained popularity as a party drug that induces hallucinations and out-of-body experiences. However, ketamine has recently been approved for the treatment of depression by the Food and Drug Administration. After this presentation, I hope that you will all leave with a better understanding on how ketamine and depression work, and hopefully you are able to detach from the stigma surrounding ketamine. Here is a brief overview of my presentation. So we will look into an introduction to the research regarding ketamine, synapses, the complexity of depression, and ending it with conclusion. Ketamine has been a drug of interest to psychiatrists since they first discovered that it alleviates the symptoms of depressions in hours compared to weeks, compared to the traditional antidepressants offered in the market. Ketamine also acts on glutamate. Glutamate is a brain chemical that is involved in the communication of the nervous system instead of dopamine and serotonin neurotransmitters that the traditional antidepressants act on. Cornell University conducted a study on stressed mice that displayed symptoms of depression, and they administered ketamine to them and they recorded the results, with the conclusion of the study being that ketamine alleviates symptoms of depression, and this has opened up a complete new avenue of research in hope to extend the relief of the depression symptoms and keeping patients from relapsing from treatment. Synapses are the connection between two brain cells. Synapses, and specifically spines, which are microscopic structures that form into synapses, were the primary focus of this study conducted by Cornell University. Mice that had an increase in the number of spines because of the ketamine treatment had a noticeable decrease in their symptoms of depression. And the correlation of the spines and depression symptom relief was confirmed with a practice called optogenetics. Optogenetics introduces viruses that target specific cells and cause those cells to produce light-sensitive proteins. After light was used to destroy the spines in the mice, the antidepressant effects of the ketamine wore off. Anhedonia is a symptom of depression where the sensation of pleasure is lost, and anhedonia was measured in mice using an experiment where mice were allowed to consume a sugar solution, and it was measured how keen these mice were on this sugar solution, how much time they spent on the sugar solution. And it was noted that increasing the number of synapses in the brain is not useful for relieving symptoms of anhedonia, only for symptoms of apathy. However, a previous study was able to find an improvement in the symptoms of anhedonia when ketamine was directly injected into the lateral habenula. That is a region of the brain that is involved heavily in anhedonia. While ketamine may not be useful in the sense that its administration itself to the mice will not reduce symptoms of anhedonia, direct injection to the lateral habenula will relieve symptoms of depression in mice. So there's also a use for ketamine in treating those symptoms of anhedonia. Ketamine has great potential when it comes to depression treatment, specifically when it comes to high-risk patients with perhaps suicidal thoughts. It may pose a higher risk for chronic patients due to its side effects that include out-of-body experiences, hallucinations, and addiction. More research should be conducted using ketamine, especially on how to extend the duration of depression symptom relief and how to mitigate its side effects. Maybe by trying to isolate certain compounds within the drug itself. But more research needs to be done in order to have a better treatment for depression. Thank you for listening to my presentation, and I hope that you all have a better understanding of how ketamine is used as a treatment for depression.